Hello, everybody. Welcome back to the Incubator Podcast live at the CHNC Symposium in Denver, Colorado. Daphna, how are you?
I'm doing great. We already had one great interview this morning.
You enjoyed that one very much.
That I really did. And we're looking forward to a whole day.
That's correct. So do you want to introduce this one?
No, you do the introduction. That's
All right, so we're joined. We are joined by two physicians that have already been on the podcast this particular symposium.
So wait, that maybe you canceled us because we were like, you've already heard from both
Dr.
of us.
Namrita Odackal and Sharada Gowda from Texas. Thank you guys for coming back and not being scared away after your first experiences this conference. And you're going to talk to us about a very special focus group that you're involved with at the CHNC. So maybe Namrita, do you want to tell us a little bit about it?
Sure. We are here representing our fetal therapy focus group at CHNC. And there are a lot of different projects that have been going on. Some projects that have involved data pulls and reporting. There's a lot of publications ongoing, and then there's some education projects we're also working on. So it's quite the diversity of members. I don't know how many folks we have on our group. Do you?
No, I don't. There's a lot. But
yeah, it's usually either that, that's usually a good sign that you cannot really have the number. Because if there were two, you would know.
Yeah.
That's right.
There's definitely more than the two of us.
Yeah. We are not it.
Well, what I think is always so interesting about the CHNC is this kind of multidisciplinary approach. So what type of members comprise this team in particular?
So there's definitely neonatologists. There's also a good representation of MFM on there, which is essential. I don't know how many. You go ahead.
Oh, no, there's fetal surgeons as well.
Yes. Oh, yeah.
Yeah.
And then I don't know beyond physicians how many APPs, nurses, etc.
I think
there's
we're not
general
gonna,
pediatric surgery and there's pediatric cardiologists as well, but I don't know about the.
So it's very interesting because it's a very collaborative group,
Right.
and then you're looking at a lot of the interventions that are gaining tremendously in popularity across NICUs around the country and around the world. One of the sessions focuses on the outcomes after exit procedures. Can you tell us a little bit about some of the data that you've encountered in this focus group that has either surprised you, piqued your interest, be like, oh my God, I didn't expect this? Anything worth sharing with the audience?
Surely, I can talk a little bit about it because Ruth Seabrook and Ellen did the majority of the work, I believe, to my knowledge.
I did none of it, so.
Yeah.
That's okay.
So what's interesting is about 80% of the data for that project actually came from just 4 centers.
Interesting.
So it's up and coming. However, it's not really that common. So I think this is a really great venue to learn from each other and then maybe establish that program at a different place if you have the interdisciplinary focus.
Or opportunities for centers who are doing these procedures to maybe participate and join the work that is being done by the CHNC and the CHND. To try to contribute data to these studies. Very interesting. And any other fetal interventions that you guys are looking at carefully that is coming up that you have enough data to actually start looking into?
So we both are actually working on the fetal intervention educational, just-in-time education process. And for that, I kind of was looking into what other interventions people actually do, not just the exit. So there's the aortic hypoplasia, so then, aortic fetal intervention for the aorta, and you have I'm mostly interested in cardiac stuff, so. And then there's the myelomeningocele closure. There's multiple other things, actually, that people are looking into. I think we should have those data pretty soon as well. We've asked for it, but it's not delivered yet, so maybe it's coming, I'm sure.
Very cool.
I think to your point, and also what Sharada is talking about, is that there's a lot of interventions in fetal therapy and fetal interventions that are not super common, and there's a small number of centers that do them, and then the rest of us know that they exist, but they're kind of magical. And so being able to take that information and not just the data, but what you should even expect at the bedside, that's sort of what our focus is with the just-in-time modules, so that if you have somebody, whether it's a fellow or a faculty member who is getting a baby who's had a fetal intervention and they're like, I've never seen this before, I really need, they're getting transferred in now. What do I need to know about what their pathology was, what the intervention was, and what I need to do in their first few minutes of resuscitation as now they're neonatologists, not having seen this before. And so the fetal therapy focus group are going to be creating these modules to say, here's 5 minutes of what everything you need to know about this thing that you hardly are ever going to see. And so, again, hopefully making that very accessible and available.
I think that's a great point, because the physiology is a little bit different than either a baby without the problem or the baby with the problem. It's a third group of babies. I think that's really cool. And I think what you bring up is a very important point. These are high risk, uncommon procedures. They will probably become more common in the next handful of years, but not all of our centers are going to do them. And yet we may consult on babies that have problems that could be fixed by fetal intervention. I wonder if there's anything that your group is doing to, expedite consultation to these fetal centers. I'd love to see even a map, was just so we know where we can refer patients. I think I do a lot of our prenatal consults, and if I happened upon a baby, it's still hard, I think, to know where to send parents if they're interested in fetal intervention.
That's such a great idea. Like since we have this access to data, if we could say this center has done X number of this procedure and, is really kind of the leading expert on this, that some centers might know, but others that may not know. Yeah, that's a great idea. No, we're not doing that.
Okay, well, I'm so happy to hear you will consider it then. Thanks.
No, I think that's a great idea in terms of, say, for example, Boston Children's has this amazing fetal intervention for vein of Galen malformation.
Right.
And we have, like, our MMC at the myelomeningocele fetal closure is really world class and, like, amazing results. So just having those data points and saying, hey, this center really excels in this one, maybe you can. Because when I do prenatal consults, I actually often find people come from East Coast and Atlanta, because there's already that kind of system built in, I believe, because we do get referrals from elsewhere, especially for our MMC and our aortic valve dilation fetal intervention. So maybe it's there. I just don't know.
And I wonder if it's available to the people that are in the know, but maybe not to
I'll tell you, for those of us kind of in the community, there's no pathway. And so we'd have to go and sit on Google and start Googling all the centers.
Oh, wow.
And even though multiple fetal centers exist, they're not all doing the same interventions,
Absolutely
right?
not.
And so
Agreed.
I think having that information would be super
Another
helpful.
thing I think these efforts go towards is educating our trainees, because not all trainees are at centers where these things are happening. And it's not really a component of board prep. But might become. And again, it should be part of their education that these are options available to their families and to their patients down the road. So having a lot of this education and information available will help trainees that aren't, or even, providers that aren't in those facilities to be able to know that that's out there and available to their patients and their families.
Very exciting. Well, we're looking forward to hearing more from your group and learning about all of these really exciting and up-and-coming types of interventions. So very cool.
Yeah. Thank you for
you.
having us.
Thank you so much.
All right.